Hello, hi, I'm Dr. Parikh from Ascot Family Dental in Roseville. You got this, you're looking at this video because you probably have recently gotten an extraction, and I'm going to go over some instructions on how to take care of the wound. And if you have any questions, please feel free to give us a call. First of all, let's look at the general symptoms. Any surgical procedure in the mouth is typically followed by some bleeding, swelling, discomfort, and perhaps some nausea during the first 24 hours. This is to be expected. If you are one of the patients who have had surgery done under some kind of sedation, whether general anesthesia or conscious sedation, it is nice that it would be important for you to make sure you are under direct supervision of somebody for first 24 hours, because I don't want you to go out shopping and purchase a whole bunch of stuff and nobody's looking, nobody's knowing. You certainly get a bill. That has happened especially for the patients who are getting some kind of conscious sedation or even IV sedation. It's not safe for you anyways. Care for the mouth. When you leave, we would have given you a pack of gauze and you were supposed to bite down on the pack of gauze. It is important that you keep on biting on it for at least 30 to 45 minutes. If after 30 to 45 minutes when you take the gauze out and if it is still soggy, go ahead and replace it with new pack of gauze. You should have also gotten some extra piece of gauze with you. Pressure is a really wonderful technique to control any kind of bleeding. So pressure is best. If you're still bleeding after some time, a lot of time what happens is blood is a pretty strong dye. So a little bit of blood mixed with a lot of saliva makes it feel as if your whole mouth is full of blood, but it is actually not. It's probably just a little bit of blood oozing out of the wound. But regardless, if you're bleeding, make sure you roll the gauze in small, couple of folds, and put it right on the socket or right on the area where the extraction was done. Bite down, make sure you're applying pressure on the wound, and pressure will stop any kind of bleeding. All right, medications. We will have given you some kind of pain medicine. The best regimen to take the pain medicine, we would have kind of explained it to you, but anyways, I'm going to go over with you again. The best pain medicine technique to take pain medicine is take ibuprofen 400 milligrams. That is Advil, over the counter Advil, which is either 200 milligram, but take 2 pills of those. That makes it ibuprofen 400 milligrams. And then 3 hours later, you can take an extra strength Tylenol. And 3 hours later you can take ibuprofen. So just alternate between ibuprofen and Tylenol for first day or two. So essentially you are having either ibuprofen in your mouth, in your body, or Tylenol in your body for first 2 days. Every 3 hours you're either taking ibuprofen or Tylenol. Continue doing that for at least 2 days. Depending on how many extractions are you getting, you might have to continue that regimen for more than 2 days, sometimes up to 4, 5, 6, or 7 days. But do that as necessary. And once you notice that, hey, you know what, I don't need as much pain medicine, start tapering it down. Ibuprofen and Tylenol combination has been proved to be even stronger than a lot of narcotic medicine. So this too is a wonderful combination. Take it as I was talking about it, and you will have either minimal pain or no pain at all. The next one is infection. There are some chances of infection, so we may have given you an antibiotic. Take the antibiotic as prescribed. If you miss the dose, make sure you take it as soon as you remember it. Swelling. Swelling is to be expected after any kind of oral surgery. The way the swelling works is it will typically go up on the first, second, and third day. It will be the maximum on the third day, and after third day it will gradually go down. In about a week or so it will have completely gone. Other really good thing that helps with the swelling is ice pack. So during the first day or two after surgery, apply ice pack 15 to 20 minutes on the affected area outside the mouth. So apply ice pack from outside for about 20 minutes and then put it in 20 minutes in the freezer. After 20 minutes, take it out again, apply it again on 20 minutes. Just keep on doing that for first 24 hours, even 48 hours. After 48 hours, you really don't need anything cold. After 48 hours, what you would really need is some warm compresses. Not anything hot, just warm. Numbness. If you are getting your wisdom teeth taken out, or if you just had your wisdom tooth taken out, especially the lower jaw, it is normal to be numb for first few hours after surgery, but after the anesthetic wears off, after first few hours of the surgery, the numbing stuff should be wearing off, and you should start having normal numbing sensation. If for some reason you still feel numbing in your jaw or lip, tongue after 24 hours, then give us a call, and we need to kind of have a look at you. Let's see. The next is diet. It is important after surgery that you have a soft diet, liquids, jambal juice, protein shakes, all that is really good during the first 24 hours. No straw during the first 24 hours, and make sure you remove gauze when eating or drinking and at the bedtime. The wound should be checked in the dental office. We would like to see you back in our office in about 2 to 3 weeks just to make sure everything looks good. If the stitches were taken, we would like to see you back again to remove the stitches. I think that wraps it up. If you have any questions, please give our office a call. Our office number here is 916-782-3129. Thank you.